Rarity of adenomatous polyps in ulcerative colitis and its implications for colonic carcinogenesis. Introduction. Colorectal carcinoma, CRC, is commonly preceded by an adenoma from which cancer can later develop via the adenoma to carcinoma sequence. In ulcerative colitis, carcinomas can develop from flat dysplasia through a different molecular pathway, designated the dysplasia to carcinoma sequence, which is driven by chronic colonic inflammation. Early observations indicated a high risk of concomitant colon carcinoma in patients with ulcerative colitis and a raised dysplastic lesion, designated a dysplasia-associated lesion or mass, DALM. This was followed by the understanding that DALMs should be distinguished from adenoma-like lesions or masses. ALMs, which resemble sporadic adenomas, are not associated with flat surrounding dysplasia and can be managed by endoscopic resection alone. Further advances in endoscopic techniques have recently prompted a proposed terminology to supersede this older nomenclature. According to this, dysplastic lesions in inflammatory bowel disease, IBD, are to be classified as invisible if dysplasia is disclosed by random biopsies, and are distinguished from visible dysplastic lesions encompassing flat and raised lesions alike, which in turn are further classified by their complete resectability or not. This terminology is probably more useful for current management and prognostication of IBD patients with dysplastic lesions. However, the older distinction between lesions that resemble sporadic adenomas by appearance and those that do not is still useful for elucidating the different neoplastic pathways underlying their development, as lesions arising through the adenoma to carcinoma sequence more commonly resemble a sporadic adenoma. Strikingly, however, in contrast with the ample research on dysplasia, there are only scant data pertaining to the prevalence of such sporadic adenomas in ulcerative colitis. Therefore, to gain insight as to the mechanisms possibly affecting the evolution of colonic adenomatous polyps, the primary goal of the present study was to investigate the prevalence of sporadic adenomas in ulcerative colitis patients compared with a similar age-matched control non-IBD population undergoing screening colonoscopy. Background and study aim. Despite ample research on the dysplasia to carcinoma risk in ulcerative colitis, there are scant data on the prevalence of adenomatous polyps in this population. Methods: the number and histology of all polyps detected at colonoscopies of ulcerative colitis patients aged greater than 50 from 2006 to 2012 were compared with similarly aged controls undergoing screening colonoscopy. Results: there were 206 patients with ulcerative colitis and 624 controls included in the study. Mean age 61.7 plus or minus 8.7 versus 60.8 plus or minus 6.1 respectively, p equals 0.15. Adenomatous polyps were detected in only 13 of 206 colonoscopies for ulcerative colitis, compared with 162 of 624 controls, 6.3% versus 25.9% respectively, odds ratio, OR, 0.19, 95% confidence interval, CI, 0.1 to 0.34, p less than 0.0001. When also considering all prior colonoscopies performed over 7.7 plus or minus 4.6 years of follow-up, mean 4.1 plus or minus 2.9 colonoscopies per patient, range 1 to 15, total 832 colonoscopies, the risk of ever finding an adenoma in ulcerative colitis patients was still significantly lower compared with controls, 14.1% versus 25.9% respectively, OR 0.47, 95% CI 0.3 to 0.72, p equals 0.0005. On multivariable analysis, adenomas were positively associated with advanced age. OR 1.07 per year, 95% CI 1.03 to 1.1, P less than 0.0001, and with increasing body mass, BMI, OR 1.06 per kilogram per meter squared, 95% CI 1.01 to 1.1, P equals 0.01, and negatively associated with having ulcerative colitis, OR 0.15, 95% CI 0.09 to 0.44, P equals 0.0005. Among 115 Crohn's disease patients aged greater than 50 years, the rate of ever adenomas in small bowel Crohn's disease was similar to the controls, P equals 0.8, and not influenced by 5-aminosalicylic acid use, whereas patients with colonic Crohn's disease had a significantly lower rate of adenomas compared with the controls, 3.9% versus 25.9%, P equals 0.002. Conclusion: unlike patients with small bowel Crohn's disease, patients with ulcerative colitis or with colonic Crohn's disease seldom develop sporadic adenomatous polyps. These data may provide novel clues to a possible role for colonic immune activation in restricting the adenoma to carcinoma sequence while propagating the dysplasia to carcinoma pathway.